Kumba julang mala usnem Nongtrei jo ka National Health Mission ka jala mekhlaya ki la penlong ya ka ji ka lang ha ka sin ka basaw ka ta ka fourth annual general meeting ya ka la penlong po St Paul Parish Hall Nongpoh River District ismu jangan ka ji ka ndu kalau marwanda ya ka ji itu para Nongtrei po ka National Health Mission menyathir halor ki mat Jingiaieit ne ki Jingiaieit para dakhat bat ru marwanda ka ji telia parang ki para Nongtrei Awan I'm CM ya ka ji ka ndu lang ki Nongtrei do ka NHM do MLE ka Nongpoh uba Mineral Bonds CM Jingiaieit ru Ram Kumar, Secretary Health and Family Welfare, but Mission Director Jagan NHM ki President but ki General Secretary, nalor ki khot ki kanun NHM na kalagi district ka Jalan Mekhlaya. Habakan ka Jalang ba Meral Boss IM ula Pynpaw ki Sokman ban yo man Jalang but baro ki Nongtrei ka NHM na ka ai ka Jingaro ru ya ka Jinglong ya tali but ru ahlor ka Jingtrei system ka jongki ban ai ka Jing Secretary baklam da chong thai na kam ta ka kam ka kot ka khia.
Belief in God and bringing people together, and others have started speaking on environmentalism, and people spoke about bringing people together. This was a very important inspiration for even when I had read about it and when I met the Ashant, also very inspiration, because when we look back from all our small difficulties or misgivings, when we look at why we go to the office or why we go to the work, why we go to the field, why we go to the hospitals every day to work, it's for the people. You are doing it for the same, I am doing for the same, our Honorable MLA is doing it for the same, and that is the actual purpose. It is not about me going and trying to sit for long hours or etc. and do something and make something. Why? This is all there for only one purpose, to ensure that healthcare of the people, particularly people who could not reach to us in time or those who could reach us in time, we deliver quality healthcare. That is the purpose. When you look at that, then everything becomes very simple. Oh, we are all here for the same purpose. Then we should not have any differences within us. We should all come together, united, and start working together to achieve that goal. So whatever is necessary to do that goal, we should work. If someone is willing to come and help us to do that, we should take them along. If someone is not willing to come, but we require their help, we should go to their house, we should go to their office, sit with them. You know, what is that? Why we require your help? Why don't you help with us? You need to take that. This coming togetherness, that is what I like a lot about today's annual general meeting. It is happening for the fourth time in the last, how many years? 6 years. 6 years. So in the last, I don't think 2-3 years it had happened. We also had gone through a rough patch in the process of settling out all the old issues in terms of rationalization and etc. I was a little upset during the initial stages where it was creating more divisions, and it was because of some errors and etc. from oversight and everything which we could have corrected. But I'm happy after that process we've been able to come together. So that is something which the NEEM Association also has done very well. I really appreciate it.
At the national level, at the state level, that we had the privilege to improve health system within our state. And we are happy in our midst, Sri Ram Kumar also is here, the mission director of NHM. And we felt that the NHM in the past few years, it has touched to a great height within the state. I have to say this today. It is due to the dedication, the sincerity of the officer, especially Ram Kumar, who are here with us, and all the officials who work tirelessly to make this mission a successful one. As I have said in my opening remark, that the policy maker of our country, be it with the system that has been placed before each and every one of us through the National Rural Health Mission then and now as National Health Mission. Also with other mission that the Government of India has launched, be it the Sarva Shiksha Abhiyan, be it the other mission that has been launched by the central government to ensure that each and every initiative that the central and the state government is taking, it has to reach at ground zero. I must confess that as a member of the Legislative Assembly in the government of Meghalaya, I have witnessed various programs within the state and outside the state also, where we had the privilege to listen, to see, to witness the initiative that has been taken by the Ministry of Health and Family Welfare, at the same time by the Department of Health and Family Welfare, Government of Meghalaya also. It reminds me of the hard work that each and every one of you has been taken in the past, especially during COVID-19, during the COVID pandemic between the year 2020, 21, 22. I must place on record my sincere thanks to each and every one of you who have worked despite of so many challenges that you have been through during those times. But still, you didn't listen to all the criticism that has been made, but you work day and night. Right from the bottom of my heart, I would like to express my sincere thanks to each and every one of you who have involved to ensure the safety of each and every citizen of the state and the country as a whole. We understand that the vision of the policymaker since the beginning, and also this legacy has been carried forward by none other than each and every one of you. The health system that we have within the state, even though there are challenges to render services due to the shortage of manpower, due to the shortage of equipments, due to the shortage of many issues are there. Even though the state government has been pursuing with the central government to have a fast-hand information, to have a support financially, technically,